My name is Mazza, and this is my video application for the 2017 JeffSolves MedTech program. I am a first-year student medical student at Jefferson, and a little bit about me: I grew up in southern New Jersey. I went to Lehigh University as an undergrad. I graduated with my physics degree in 2015 and my chemistry degree in 2016. And I did a lot of bench science research at Lehigh, which made me realize that being in a lab all day by myself was not the right path for me. But when I decided medicine, it was really a combination of many things, but one of those was from experiences I've had in engineering design and conceptualization. I knew that becoming a physician, I'd love to participate in some sort of medical device application and conceptualization and design as part of my career. So when I heard about the MedTech program, I got super excited because it seemed like an awesome way to supplement the textbook learning that my classmates and I are doing year long into a way that's more applicable and more fun in terms of collaborating with my peers, with people in the Philly area, the people at 10X Beta, the administration at Jefferson that's part of this program, collaborating with them and being able to take what we're learning and solve problems that are current in the healthcare field. So I appreciate the opportunity to apply for the program, and I will jump into the customer profile of the product that I chose from the seminar. So the device or the medical problem that I decided to pursue was brought up by a fourth-year medical student, and her idea was that in hospital floors and in settings where patients have a lot of monitoring leads connected to them, there's a bunch of wires always present, and they can get jumbled, and there can be so many that it gets confusing. They get tangled. It's hard to transport patients with all these wires, and overall, the just vast amount of wired devices to the patient makes it disorderly and creates maybe less of a comfortable environment for the patients. So I thought that this seemed like a problem that could definitely be fixed by by a device design that can take those monitoring capabilities and turn them into a wireless form. So the topic, I guess, could be titled something like wireless patient monitoring devices. And so, yeah, I'll jump right into the customer profile. So starting with the customer jobs, one thing that I just want to say with this and with a lot of other medical tech devices, I think that there's definitely multiple customers. So the customer of the healthcare institution that would be purchasing these technologies, that's the initial direct customer, as well as the more indirect customer of the patients themselves that are consumers of the healthcare institutions that would have these technologies. But for my customer profile, I'm just going to focus on the healthcare institution as a whole. So customer jobs, really what I thought of was the most important job of the healthcare institution with regard to patient monitoring devices is to ensure that the devices are accurately representing the analysis of the patient and that they are providing the best quality of measurements that they can, so the physicians and other healthcare providers have the accurate data they need to help these patients get better. That's the most important thing. But another main thing is that healthcare institution, it's their job to make the healthcare environment as safe as it possibly can for these patients. So if there are things that are possibly higher risk or affecting the safety of patients, like too many leads while you're trying to move a bed and they get jumbled or caught and things like that, that is the job of the healthcare institution to eliminate those types of things. And it's also maybe towards some less important or less immediate jobs of the healthcare institution. It's important for the healthcare institution to maintain an orderly work environment and a patient environment that's conducive to them getting healthy, as well as an environment that care providers can function well in and can easily understand how to use everything in that environment to do their job, as well as it's important for the institutions to maintain a level of social reputation that shows that they are an institution where people can come and feel like they trust their healthcare providers and want to come and benefit and get healthy quickly. as well as it's a job of the healthcare institution to kind of stay up to date with technologies and improving means of providing care so that they can offer those consumers, those patients, the best possible outcomes for them when they need help. The pains associated with a healthcare institution that, in regard to the problem of patient monitoring devices, the most extreme are the avoidable harm that can be caused to patients or injury to patients during transportation, as well as more generalized loss of trust with patients and negative experiences that they have while in that healthcare institution. That's the thing that they want to probably avoid most. But as well, that other things that are important are, in order to kind of maintain that environment and that level of quality, the costs associated and the initial investments to get into or to be able to have those environments for the patients and the care providers working there are another pain that the healthcare institution needs to really consider. And maybe some less important are kind of this idea of introducing new technology, but it having maybe a high learning curve for the care providers. It may not be quick and easy for them to adapt and implement into their care provision. But that's another pain that the healthcare institution needs to consider. Primary gain that healthcare institutions would experience from some new higher technology patient monitoring devices, the most direct or obvious gain is having a less confusing or complex system of wires that still allow you to accurately monitor the patients and to decrease patient mishaps and overall risk in general. But even more in the broader sense, the elimination of so many wires on a patient overall will allow the recovery environment for patients to be a lot more comfortable and to really boost their experience while in the healthcare setting, which just leads into the gains of increased consumer imaging for that healthcare institution and just increased reputation, a beneficial reputation for the healthcare institution as well. And some other important gains would be failures in the monitoring of patients could be minimized by new advanced technology, as well as the elimination of provider errors related to those monitoring tasks and fields, as well as just the new technology could be easy to use and easy to learn, so care providers can quickly do it and quickly implement it. And the cost, can always be minimized to a degree through good engineering design and design thinking to cut those costs down while maintaining that high quality that the healthcare institution would require to perform its everyday job. So just to kind of bring together the customer profile for the product that I chose. Sorry, don't mind. This is my dog Newton behind me. He may be barking, but just to bring everything together, I think that there's a lot of potential in this problem specifically for solutions. But I started thinking about what really makes this medical device design and technology design interesting. And to me, it's like, take a wire or a string that's so knotted up and just so messed up that I know I personally could work at it for hours and maybe get a bunch of knots out. But at the end of the day, it's going to take me going to friends or other peers or other colleagues and having another set of eyes look at it and come up with different ways to go about getting the rest of those knots out. And that's just something that I find really intriguing about device design and implementation is working with people of all backgrounds, my peers from school, people within Philly, 10X Beta, people at Jefferson, just coming together and working day to day to try to solve even one issue and develop a product that makes patients' lives better, physicians and other care providers' lives easier is something that's just, it's awesome. And I'm appreciative of the opportunity to apply, and I thank you for your consideration. So happy holidays and happy New Year as well. Thanks.